everyone. This is our Advocacy Action Plan. This is the AANA Blue Group. In our group is Erick, Jessica, Sarah, and me, Hana.
Here you'll find our 60-day action plans separated in 2 weeks. For week 1, we were going to evaluate current CRNA policies and practices within the VHA, analyze data on the impact of full practice authority for CRNAs, as well as identify key stakeholders and schedule meetings or surveys to assess perspectives on CRNAs and full practice authority. For week 2, we were going to research areas in the VHA that can benefit from CRNAs practicing to their full extent, compare CRNA scopes of practice at other facilities, compose a persuasive letter to the VHA of the U.S. Department of Veterans Affairs supporting full practice authority, hold a town hall meeting to educate the public about the benefits of CRNA's scope of practice. In week 3, we will develop a step-by-step plan for implementing full practice authority in the VHA, create advertisements and social media content to support the CRNA's full practice authority, collaborate with professional organizations to advocate for CRNAs and gain guidance, as well as start planning a national event to gather support through a petition. And for week 4, we will advertise the benefits of full practice authority on social media, continue to develop the proposal and letter to the U.S. Department of Veterans Affairs, as well as organize another town hall meeting for Q&A and address concerns. In week 5, we plan to work with the policymakers and lawyers to refine the proposal and letter, continue organizing the national event, and promote it on social media. On week 6, we'll collaborate with the VHA administrators and directors to address concerns and seek support. We would hold a final town hall meeting to discuss the proposal and event, and continue to advertise the national event on social media. Week 7, we would finalize and send the persuasive letter to the VHA of the United States Department of Veterans Affairs, then complete the proposal with evidence-based research, SWOT analysis, and visual data. We would ensure the national event is well prepared for virtual attendance and petition signing, and we would continue advertising the event on social media. In the last week, we would host the national event to gather support for CRNA's full practice authority. We would network with the U.S. Department of Veterans Affairs leadership to gain further backing, and we would collect signatures and support for the petition.
Week 1 will consist of evaluating the current policies and practices at the VHA regarding CRNAs and analyzing data related to the effects of full practice authority of CRNAs, including patient outcomes, patient satisfaction, access to healthcare, staffing, and cost effectiveness. We will also identify key stakeholders within the VHA, including directors, administrators, physicians, CRNAs, and most importantly, the patients, and schedule meetings and surveys with these stakeholders to assess the current culture and perspectives of full practice authority for CRNAs. In week 2, we will continue to research full practice authority for CRNAs, including their current scope within the VHA compared with other facilities, and how enacting this change has the potential to improve the VHA system. We will also compose a letter to the VHA of the U.S. Department of Veterans Affairs outlining the benefits and support of full practice authority for CRNAs. A town hall meeting will be held that will be open to the public, highlighting the importance of CRNA's scope of practice, their current role in the VHA system, and how granting CRNAs the ability to practice to the full extent of their licensure will benefit the VHA. A Q&A session will follow the town hall. Week 3 will begin the process of designing and organizing a plan to present to the U.S. Department of Veterans Affairs. We will also develop advertisements and social media that support enacting full practice authority in the VA system. We will collaborate with other professional CRNA, nursing, and medical organizations that can advocate for and help guide the process of CRNAs gaining full practice authority within the VHA. And the process of planning a national event in support of enabling full practice authority will occur here. The goal of the event is to have as many attendees sign a petition in support of the proposal. Week 4 will focus on continuing to gain support through social media, as well as using it to advertise meetings and Q&A sessions related to CRNA full practice authority. We will continue to develop a proposal and letter to send to the U.S. Department of Veterans Affairs and organize another town hall meeting that is open to the public for Q&A. Topics that will be discussed include CRNA's roles and responsibilities, the current scope of practice of CRNAs in the VHA, benefits of enhancing full practice authority, misconceptions about CRNAs and full practice authority, and weaknesses and challenges that could present barriers to enacting full practice authority within the VHA. In week 5, we will work with policymakers and lawyers to edit the letter and the proposal of the stepwise process of granting CRNAs full practice authority in the VA system. We will continue the process of organizing the national event for the petition, and we will begin advertising the event on social media. Week 6 is dedicated to collaborating with the VHA administrators and directors to address possible concerns related to the proposal of granting CRNAs full practice authority in the VHA system and the petitioning event. Another goal of this collaboration is to receive guidance on gaining support from leadership of the U.S. Department of Veterans Affairs to grant CRNAs full practice authority. A final town hall meeting and Q&A session will be held regarding the proposal and national event. We will continue advertising the event on social media and emphasize the ability to attend the event and sign petitions via mobile device or computer. Week 7 will be dedicated to putting the finishing touches on each piece of the puzzle. We will finalize and send the letter to the VHA of the U.S. Department of Veterans Affairs outlining the benefits and support of full practice authority for CRNAs. We will finalize the proposal of granting CRNAs full practice authority in the VHA system that will be presented to the U.S. Department of Veterans Affairs. Information included in the final proposal is the SWOT analysis, evidence-based research, charts and graphs that visually explain data, and access to resources that further support the plan. We will also finalize the details of the national event for the support of the proposal of CRNA full practice authority in the VA system via petitions. We will ensure the ability to attend the event and sign the petition virtually via mobile device or computer and continue to advertise the event on social media. Week 8 is all about putting advocacy into action. This is when the national event to petition enacting full practice authority for CRNAs within the VHA system takes place. The goal is to network with the leadership of the U.S. Department of Veterans Affairs and open a line of communication related to granting CRNAs full practice authority within the VHA. And of course, to get enough signatures in support of enacting full practice authority for CRNAs within the VA system.
The safety record of anesthesia is a testament to the advancements in the field. Anesthesia techniques, medications, and monitoring have greatly evolved, resulting in significantly reduced risks and complications. The introduction of new anesthetic agents and improved monitoring equipment have contributed to the high level of safety achieved in modern anesthesia. CRNAs undergo rigorous training and education, equipping them with knowledge and skills to administer anesthesia safely and effectively. When it comes to cost effectiveness, however, studies have shown that CRNAs are consistently providing cheaper anesthesia care, lower costs compared to physician anesthesiologists. This is particularly important in the context of the VA healthcare system where financial resources are limited. By granting full practice authority to CRNAs, the VA can capitalize on their cost-effective practice model, allowing for optimal utilization of resources and allocation of funding to other critical areas of healthcare. In addition to cost effectiveness, expanding CRNA full practice authority would address the ongoing healthcare access challenges faced by the VA system, especially in underserved areas and rural locations. CRNAs are well suited to meet the anesthesia needs of these communities as they can provide high-quality independent care. By leveraging the skills and expertise of CRNAs, the VA can ensure that veterans receive timely access to anesthesia services, eliminating potential delays in their healthcare journey. CRNAs also have a long-standing relationship with the armed services and have played a vital role in providing anesthesia care to military personnel on the front lines. Their experience in delivering anesthesia in high-stress and demanding environments makes them uniquely qualified to care for veterans returning from service. Granting CRNAs full practice authority within the VA system acknowledges and utilizes their expertise, ensuring that veterans receive the same quality of care they experienced during their active duty. By embracing CRNA full practice authority, the VA system can effectively address workforce shortages and recruitment challenges. CRNAs are an essential part of the anesthesia workforce, and expanding their practice authority would attract and retain skilled professionals dedicated to serving veterans. This, in turn, enhances the overall capacity and efficiency of the VA healthcare system, ensuring that veterans receive the care that they deserve in a timely manner. Lastly, expansion of CRNA full practice authority within the VA healthcare system offers numerous benefits. It enhances patient safety through utilization of highly trained professionals, provides cost-effective care, improves access to anesthesia services, acknowledges the historical relationship between CRNAs and the armed service, and helps address workforce challenges. By supporting the granting of full practice authority to CRNAs, the VA can optimize its resources and deliver high-quality anesthesia care to veterans across the nation.
These are some frequently asked questions. What is a CRNA? A CRNA, or a Certified Registered Nurse Anesthetist, is an advanced practice registered nurse who specializes in providing anesthesia care to patients. CRNAs are highly trained healthcare professionals who administer anesthesia during surgical procedures, monitor patients' vital signs, manage pain, and ensure patients' safety and comfort throughout the anesthesia process. CRNAs work in various healthcare settings, including hospitals, surgical centers, and clinics, where they collaborate with surgeons, anesthesiologists, and other healthcare professionals to deliver anesthesia services. They have the authority to evaluate patients, develop anesthesia plans, and administer these anesthesia medications while monitoring patients during surgery and managing their postoperative pain. What is full practice authority? Full practice authority refers to the extent of autonomy and independence granted to certain healthcare professionals, typically APRNs, such as nurse practitioners, certified nurse midwives, and CRNAs, to practice to the full extent of their education, training, and competence. The specific scope of full practice authority can vary depending on state or jurisdictional regulations and laws. In some regions, APRNs may have full practice authority, allowing them to practice independently and autonomously without any physician involvement. In other areas, though, APRNs may have limited practice authority, requiring them to collaborate with or be supervised by a physician to varying degrees. How will updating regulations and giving CRNAs full practice authority be beneficial? Full practice authority for CRNAs can help address the issue of limited practice to healthcare services, particularly for our veterans. CRNAs can provide anesthesia and pain management services independently, reducing wait times for patients and increasing the availability of care. Further, granting CRNAs full practice authority can optimize healthcare delivery by leveraging their skills and expertise. They can work to the full extent of their education and training, reducing the need for physician supervision and collaboration. This leads to streamlined workflows, improved efficiency in surgical procedures, and faster patient turnover. CRNAs are generally less expensive to employ compared to anesthesiologists. Allowing them full practice authority can help to optimize healthcare costs by utilizing the skills of CRNAs in a more independent and cost-saving manner. This can result in cost savings for healthcare systems, insurers, and patients. There is a shortage of anesthesiologists and other healthcare professionals in many regions, particularly in rural areas. Granting CRNAs full practice authority expands the pool of anesthesia providers, enabling better coverage and addressing workforce shortages. This helps to ensure that patients, including veterans in the case of the VA health system, have access to timely anesthesia services. What are some issues impeding the decision? What are some issues impeding the decision to give CRNAs full practice authority? Physician organizations may raise objections, contending that the expansion of APRN's scope of practice undermines the importance of physicians and jeopardizes patient safety. Overcoming this opposition and establishing collaborative partnerships between physicians and APRNs could present a challenge. Further, while APRNs receive comprehensive training and education, there may be variations in their backgrounds and experiences. Ensuring standardized qualifications and competencies amongst APRNs and CRNAs is crucial to maintaining high quality care across the VHA system.
This is the letter we drafted for support. By following this 60-day action plan, the goal is to raise awareness about the benefits of granting CRNAs full practice authority within the VHA system and garner support from stakeholders, the public, and leadership. This process aims to facilitate positive change and enhance healthcare delivery within the VHA, benefiting both patients and CRNAs alike.